Hello guys, I'm Dr. Mahesh Sunakarasu. I welcome you all today for this session. Today we're going to talk about something different topic. Everybody gets through this situation at some point in time. What is that? I don't know why since this morning I've been feeling a little nervous or anxious. I don't know why. Have you been through this stage? Like, have you ever felt anxiety? Have you ever been, come across this stage? You know what I'm saying? Yeah, exactly. We're going to talk about anxiety disorder or panic attack. Okay. In this video, we're going to talk about what do you mean by anxiety disorder or panic attack, and what are the different types of anxiety disorder, and what are the causes and risk factors, and how do you diagnose, and what are the symptoms. Once you get diagnosed with anxiety disorder or panic attack, what are the treatments available, and what are the tips, and what are the foods that you can have to avoid this anxiety disorder or panic attack. So in order to get all the answers to these questions, please make sure you watch this video without skipping it, okay? And then if you have not subscribed to my channel yet, please go ahead and hit the subscription button down below, and do like it or leave a comment down in the comment section. Let's get in there, guys. Anxiety disorder. Anxiety disorder is just it's a common emotion and a normal thing to have. Every human being, it's a common thing to go through this anxiety disorder. Disorder is different. Anxiety is a common thing. Okay, you are feeling a bit nervous whenever you go to any office, or for example a child who goes to school, or adolescent stage when they go to school, or young adults when they go to college, like whenever they face any exam. If you're working, whenever you face your boss when he gives you some work to be done on some particular time, when you don't do that on time, you will feel nervous, you will feel anxious, right? For example, when you go on to stage to speak to a public or a group of people, some people feel anxious, they get nervous, all that, okay? But feeling anxious once in a while is okay. Occasional anxiety is common, it's okay to have that. But what is abnormal? When it has become a disorder, okay? That's the most important thing. Some people, for everything, for any small event or for any small trigger that happens, they react out of proportion. They develop overwhelming fear or worry to that triggering event. It's just kind of out of proportion. That is called anxiety. When they get anxiety, they become nervous, they start sweating, they get into difficulty breathing, as if something got stuck in their throat. They start sweating, their hands and legs go numb, and they feel that the heart is beating too fast, pounding chest, all that. Sometimes some people would even have a vision problem as well. So these are the things out there. Okay, and now let's talk about the types of anxiety disorder. General anxiety disorder, it's a common thing. It's just overwhelming worry or a reaction. When there is a imbalance in chemicals in your brain, people get this anxiety disorder. Okay, in general anxiety disorder, it's one of the most common thing that men and women, they have this. And the other thing is like social phobia. Some people, they always think of, okay, I don't want to go there, I don't want to go to that event, I don't want to go meet this kind of people. They keep judging me, I get embarrassed, or I get judged by these people, and I don't want to get judged, or I don't want to be embarrassed. So because of this common fear, they avoid all these things. But this would be just out of proportion, you know what I'm saying? Other phobias, like specific phobias, like acrophobia. Some people are fear of heights. Some people are fear of dark spots, like agoraphobia and things like that. And some people have separation anxiety disorder. When you send the kid to school, or when you separate the kid from his or her mother, the kid cries. That's a separation anxiety disorder, and it's a common thing for adults as well. But then they will come over with it. Okay, they just get over with it. That's not a problem. There are many more types, and these are some common types of anxiety disorder. And what are the causes and risk factors for anxiety disorder, panic attack? There are several causes. There are some genetic causes. You can change all this. Modifiable and non-modifiable risk factors are there. So genetics, you can't do anything about it, okay? And then environmental factors, of course, right? And some modifiable factors like your health conditions. If you have any underlying conditions related to your heart or lungs, those can be treated. Okay, and some conditions that cannot be changed. There are some habits that people develop, like substance abuse to tobacco or alcohol or recreational drugs and many more things. So these are some of the causes and risk factors. Okay, and what are the symptoms? As I said before, people when they come to emergency room, people with the anxiety disorder or panic attack, they don't come to your outpatient department. They go to emergency room like ailing, doctor, I'm gonna die, something is there in my throat, oh, I can't breathe, I'm sweating, my heart is beating too fast, my heart is going to explode and it's going to bleed, something like that, as if they are getting into real heart attack. But on the other hand, the doctor who is evaluating this patient, when looking at the patient's age and other comorbidities like other underlying diseases, when a doctor asks the patient's attender directly to the patients whether he is smoker or alcohol, and when they take ECG everything looks normal, and when they check oxygen level in the lungs, that saturation, that SpO2 or SaO2 will be normal, like 98, 99, 100%. But on the other hand, like acute shortness of breath in lung causes or heart causes, they will have a profound hypoxia with a less amount of oxygen in the blood. But in anxiety disorder or panic attack, they will have a normal amount of oxygen, like 99% on room air. But just because they have a good amount of saturation on room air, we cannot just undermine that this guy is having panic attack. But you have to do ECG. You have to do ECG whether this person is not having heart related difficulty breathing or lungs related difficulty breathing. So do ECG and chest x-ray. If it's really necessary, you can even go for a cardiac enzymes to rule out a mild heart attack. And many more symptoms to it. Symptoms other like numbness in the hands. People develop numbness in the tongue, face as well, and even the limbs. Okay, and they feel that the excessive sweating, sometimes they do get nausea, vomiting, abdominal pain, any kind of symptoms they do get in anxiety disorder and panic attack. Okay, so these are some of these common symptoms that they have. And diagnosis, when it comes to diagnosis, it depends. So your doctor evaluates you, he asks you a lot of questions, and he will want to run some blood tests to rule out all the organs are normal. Things like he will check your thyroid function status, he will take a ECG to make sure the heart is okay, and they may even do chest x-ray to make sure everything is fine. Okay, because there is no single confirmatory test to say, okay, this person has anxiety disorder or panic attack. Okay, it's all just we have to make sure everything is okay, and then based on the patient's symptoms, age, and with no other associated diseases, they may diagnose, okay, this patient has anxiety disorder or panic attack. Once the patient is diagnosed with anxiety disorder or subtypes of anxiety disorder or panic attack, we usually refer patients to psychiatric doctor or psychologist or a clinical neurophysiologist. So what they do, they start patients on antidepressant medications. There are several antidepressant medications for this anxiety disorder, things like SSRIs or SNRIs. They start on buspirone and tricyclic antidepressants, monoamine oxidase inhibitor. There are various drugs. So some drugs are good for some patients, and those drugs this patient should have this for at least like 4 weeks to 6 weeks to see its a beneficial effect. You cannot just pop up like 1 or 2 pills for 1 or 2 days and see for doctor, I'm not getting any positive outcome on this attack, this medicine is useless. You cannot say things like that. It at least takes like 4 to 6 weeks to see beneficial outcome. Okay, we are done with the treatment, and how you can manage this attack, like what are the tips, what are the foods that you can eat to avoid this anxiety disorder, panic attack. Foods like Brazil nuts, fatty fishes like salmon, mackerel fish, sardine fish, herring fish, tuna fish, and all that. Go for this vitamin D, like milk, dairy products contain vitamin D. Eggs also very good, and pumpkin seeds. and chia seeds. Okay, go for whole grain food items or unprocessed food items. And then chamomile tea is also very good, because all this food like fruits, vegetables, all this contain good amount of vitamin A, D. They are all loaded with antioxidants. Antioxidants are the scavengers. They go and attack these toxic free radicals, and then they get rid of these toxic free radicals from your body. Even you could even try this green tea in addition to chamomile tea. They are all very they're just completely loaded with the antioxidants. And there are some tips how you can manage, whether you can just before getting to anxiety disorder or once you are diagnosed with anxiety disorder, you can try these tips in addition to your medications. Like stick to your treatment plan. If you are a person of taking too much caffeine or tea, you should cut down on that. And of course, alcohol consumption as well. And if you're a smoker, you should quit smoking, and you should find some free relaxing time. You go out with your friends and just talk to your friends. There is a team support. You can have a group of friends, you can talk to each other, things like that. You can discuss with one another how it's going on, what kind of things I have been going through, what are your symptoms, or what medications did your doctor prescribe to you, things like that. The support team are available for all this. Okay, and I hope you have enjoyed all this information that I have provided here on this video. I'll see you soon, guys, in our next video with more good information. Alright then, I'm signing out. It's Dr. Mahesh. Bye bye.